in there. Okay? And then you also have the articulation between, what's this bone here that's inside the tendon? The patella. Okay? So the patella is going to articulate with the cartilage mostly on the femur. Because the femur looks kind of like this on the front, and then you have the patella that goes in that groove right there. You can see on this picture on the handout. Okay? And so actually, in between the tibia and the femur, you have the meniscus. And we'll talk a little bit more about the meniscus when we have some pictures in there. Basically, it's a cartilage. It's not just a flat disc. It's sort of like a, you know those things they ride bicycles on the velodrome? It's kind of shaped like that. It's like a bank thing that goes all the way around. And then the condyles of the tibia fit against that little banked area. Okay? One's shaped like an L, a C, and one's shaped like an O. And we'll show that in a little bit. All right, so then we've already talked about what's the muscles on the front compartment of the thigh that extend the knee. Quadriceps, right? So that's going to be rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. Okay? And then we talked about this Q angle. Okay? What that is you have the pelvis coming like this, you have the femur here, and then you have the tibia here. Okay? This angle right there that's drawn along the shaft of the tibia through the patella, and that's on the picture on the handout there, is one part of the angle. It's actually coming from the ASIS, from here. Right? And then the other part of the angle is from the patella down along the tibia. Okay? So the more that it comes in at an angle, and I kind of talked about the Q angle before. Right? The farther out the hips are, the more the angle that the femur comes in, the more that the patella is going to be pulled laterally. Okay? So you're talking about how the angle of the femur coming into the tibia. And it's typically going to be more of an issue in females because obviously because of childbearing, the pelvis tends to be wider so that the femur comes in at a sharper angle. So if this tibia, the femur is coming in like this and the tibia is like that, when these muscles contract, they're going to have a lateral force on them. Okay? So the patella typically tends to get pulled laterally. And then we talked before about in rehabbing, you try to work the vastus medialis, it's trying to pull the patellar medially. Okay? So that's what the Q angle is. What it has to do with is how the difference between the angle of the femur coming in meeting to the tibia. That's usually out at an angle like that coming from the outside going in. So, like it says in the handout, the bigger the angle is, the more of a risk you have of the patella being forced out laterally. All right, so then the knee joint has a capsule, but some of the ligaments are inside of the capsule and some of them are outside of the capsule. Okay? Anteriorly, there's a retinaculum that covers all the front part of the knee. But on the back side, it's a little more open. Okay? This fascia that's continuous with the quadriceps tendon kind of covers around the front part of the knee. Whereas on the back side, it's a little bit more open. And like I said, there's intracapsular ligaments and then extracapsular ligaments. Okay? So the ligaments that are on the outside of the capsule go along the sides of the knee. Those are going to be the lateral collateral and the medial collateral. And when we say collateral, that means it's going along the side. Is that a question? Okay. All right. So those are the extracapsular. So obviously on the lateral side, you can have lateral collateral, and then on the medial side, you can have medial collateral. So it's just like when we talked about in the elbow, the collateral ligaments go along the side. And what kind of movement are they going to prevent? So if we're talking about the medial collateral ligament, it's going to prevent this tibia from moving laterally. And we don't be talking much about that. That's what's that called? Is that valgus or varus? Valgus. Right, because the way you remember it is whenever you're talking about a joint, you look at the distal part of the extremity. So if I'm talking about the elbow, this is the distal part of the extremity. If it moves laterally, then that's valgus. If it moves medially, then that's varus. So you always have to look at the extremity distal to the joint. So the distal part of the extremity, if it moves away from the midline or laterally, that's valgus. And then if it moves towards the midline, that's varus.
Does valgus and varus stand for anything?
If I remember right, I looked up the actual word. I think it means moving away from the. I forget the exact definition. Are you just asking like what the word means, or?
I just didn't know if there was more to it.
No, that's pretty much it.
All right.
It's just talking about moving away from the midline and towards the midline. Towards the midline. So valgus means L for lateral, but you just have to remember that it refers to the distal part of the joint. Okay. So let's see. So then you have the anterior and posterior cruciate. So I'll talk about the anterior and you talk about the posterior. When you talk about the anterior and posterior cruciate, the most important thing to remember is that it has to do in terms of the tibia. Okay? So when you talk about anterior cruciate, it attaches to the anterior part of the tibia and it prevents anterior movement of the tibia in relation to the femur. Okay? So next week when I have the PowerPoint and slides, I'll show you some videos of orthopedic tests and things for the cruciates. And then the posterior cruciate, I'll let you take it. Okay. Yeah, we happen to do it old school today.
It's also in the notes. I saw it in the notes. Okay. Okay, so this is the back of the knee, and like you're saying, there's two extracapsular ligaments on the outsides, and then the two intracapsular, the anterior and posterior cruciate, and they form sort of like a crisscross in the middle of the knee to prevent like anterior and posterior stress on the knee. And the posterior cruciate ligament originates at the intercondylar surface of the tibia and inserts into the medial condyle of the femur, and it helps hold it together and also prevents the femur from coming, or I guess the tibia from moving backwards in relation to the femur, I guess. So like if your femur's up here, it prevents like this motion. And like common injuries occur like during car accidents or sports injuries when somebody hits really hard on the shin bone, and you just tear it there.
So like you said, like I said, is that if you always remember and you think of the word anterior and posterior cruciate, think of the tibia. Okay. The anterior cruciate attaches to it runs from the back side of the femur and attaches anteriorly to the tibia, and it prevents anterior movement of the tibia in relation to the femur. And then the posterior cruciate attaches to the posterior part of the tibia, and it prevents posterior movement of the tibia in relation to the femur. So the words anterior and posterior, when you're talking about the ligaments, it applies to the tibia in relation to how it moves against the femur. Okay? And I think we'll talk about